Hello and welcome again. Dr. Anthony Gonzalez here for Miami Community Health. Another interesting topic we have with us today. It's something that all of us do. Some of our programs are about women's health. Some of our programs are about men's health. Some of them are issues that you don't have. But what we're going to talk about today, everybody has to do it every day, or else really your health and your well-being is not going to be in order. So today I have Dr. Harneet Walia with us today. And what we're going to talk about today is we're going to talk about sleep. Sleep is very important. It's just a recurring theme. And that's why I wanted to invite her. Every time we had a topic here, whether we're talking about mental health, whether we're talking about cancer recovery, whether we're talking about obesity and fitness, sleep always came as a common theme. And so what better to bring a specialist on sleep? So Dr. Walia, thank you. Welcome.
Thank you for having me. It's a pleasure to be here.
Pleasure. So we recently met because she's recent to Baptist Health. Tell us a little bit about yourself.
Yes. So my name is Harneet Walia. I'm a sleep medicine specialist. I did my fellowship at Case Western Reserve University Hospitals at Cleveland, and then stayed on as a staff there for 2 years, and then joined Cleveland Clinic in Cleveland, Ohio. So I stayed on there for 8.5 years. I was also the medical director of continuous improvement, and we recently moved down here in Miami and have joined Baptist Health as the medical director of sleep medicine and continuous improvement in the MCVI.
Wow. So sleep, a doctor, the lay public wouldn't even think that you can go see a doctor for your sleep. What does a sleep doctor do?
We treat patients with various sleep disorders. There are actually more than 80 sleep disorders that exist out there. And many times they often get under-noticed, under-recognized, under-treated. And more common ones are obstructive sleep apnea, insomnia, restless leg syndrome, people who are excessively sleepy, such as narcolepsy, and even circadian rhythm disorders or shift work disorders. So we treat people with all sort of sleep disorders and then take care of them.
And of course, sleep is important, right? I mean, there is a function for sleep, and I guess God created the rest for us to recover. I mean, what is the function of sleep?
Yeah, for many years, it has been thought to be a passive situation. Actually, sleep is both passive and an active situation. It is critical. That's the time when our body repairs, it revitalizes, we sort of consolidate our memory. The first half of the night, we spend most of the time in what we call as non-REM sleep or non-rapid eye movement sleep. And the latter part of the night is mostly constituted by rapid eye movement sleep, which is the dream sleep. In the non-rapid eye movement sleep is when our body sort of slows down, the blood pressure drops, the heart rate drops, and we are sort of recuperating those effects that our heart has undergone throughout the day. And during the rapid eye movement sleep is when we dream and we consolidate our memories.
And isn't there a cycle? I've heard that, there's this thing about power naps you've heard, right? So if you sleep enough, you'll feel like you got a lot of rest. But if you don't sleep enough, is that the cycle has a certain length of time?
Yes. So typically, we all need a certain amount of sleep. And I'd like to emphasize that we all need, especially the average adult, requires 7 to 9 hours of sleep. So, and in a typical night, we go through maybe 5 to 7 cycles of sleep, which constitutes non-REM and REM sleep. REM sleep typically occurs about 90 to 120 minutes once we get into the sleep. So you have to have those cycles of sleep to get the full benefit of the sleep.
Wow. So you have to have at least, an hour and a half or two to get that whole cycle.
Absolutely.
Right. And 7 to 9. So what happens if you're not sleeping? You're only sleeping 4 or 5 hours a night. What happens to the body?
Well, insufficient sleep is an epidemic. In United States, 1/3 of us cut our sleep short due to various reasons, right? But like I said, we require 7 to 9 hours of sleep. Insufficient sleep has huge implications, and ranging from impaired memory, impaired concentration, you feel tired, you feel groggy. Not only that, in terms of other health outcomes, insufficient sleep has been linked with obesity, the weight gain, diabetes, cardiometabolic diseases, heart problems, heart attack, impairment in immune function also. So sleep is just critically important, and sometimes we just don't realize the benefits of sleep.
Can you sleep too much? I guess as a teenager, I used to like to sleep in. I slept in on Sundays almost to football kickoff at 1 p.m. As an adult, you can't do that anymore. But can you sleep too much?
So you were probably catching up on sleep, right? So you were catching up over the weekends. So that's a different story. But there are other folks who are intrinsically sleepy too. They require sleep. And those are people who may have sleep disorders such as narcolepsy. And sometimes people are sleepy because they don't get good night's sleep because of sleep apnea and whatnot. So there are many reasons why people may be sleeping too much, and one has to really delve into it.
Right. So you have to get the sufficient amount of sleep, not too little and not too much.
Not too little.
Okay.
Not too much.
So let's talk about some of the disorders you deal with. You mentioned some of them. Sleep apnea, very common. And I see it in my world of patients with obesity and bariatric surgery as well. So explain to our audience, what is sleep apnea?
So there are two main kinds of sleep apnea. Obstructive sleep apnea is the most common one. It's a condition when you have a recurrent airway closure throughout the night, and we measure it by this metric called apnea-hypopnea index, or AHI. It's essentially how many times you're having these episodes of stopping or decreased breathing throughout the night. And it's oftentimes under-recognized, under-treated, and it can have huge implications in your day-to-day life.
So how does somebody know that they have sleep apnea? So, somebody out there may be overweight or obese. How do they know?
Yes. So weight is a big risk factors. Some of the other common symptoms and signs to look for is snoring, loud snoring, somebody having pauses in breathing. That's a very sensitive sign. Somebody having restless sleep, somebody who's waking up in the middle of the night quite a bit, somebody who is tired and sleepy and fatigued during the day. So those are some of the symptoms to look for when you're checking for sleep apnea.
So you obviously have to ask somebody, unless you snore so bad that you wake yourself up, which I've heard patients tell me, I snore so loud I wake myself up. I was like, okay, but
or
you have
your
to
bed partner.
Your partner. I was just going to say, so you have to ask somebody else and see if you sleep. Okay, so your partner says yes, he or she snores a lot. How do you diagnose it, and then of course, how do you treat it?
Yes, and not all snorers are going to have sleep apnea, but snoring is really the hallmark feature of it. So then they would present to the office, and we do need a sleep study to formally diagnose a patient with sleep apnea. And there are two kinds. One is in the lab, where we hook them up with lots of monitors and see if they have sleep apnea. If they do have it, how bad it is. And the other kind of sleep study is a home sleep apnea testing, where they could do the study at home, and they can either ship the equipment or bring it back, and then we are able to ascertain whether they have sleep apnea or not. Home study is mainly for folks who we think are for sure going to have sleep apnea. It's more of a confirmatory test. And lab study is somebody who has either low risk of sleep apnea or somebody who has multiple other comorbid conditions.
Okay. Yeah, I had a patient recently who told me they did it at home, and I didn't realize it was a home test, and I learned about it after that. So somebody is diagnosed with sleep apnea, and the treatment now is what?
Yes. So there's always a conservative approach. One is, if one is overweight, try to lose weight, avoid sleeping on the back. Sometimes people have sleep apnea more on their back. Exercise, diet, all those good things are going to help. Positive airway pressure therapy still remains the mainstay treatment for sleep apnea. And how it works is it essentially blows in the air and splints open the airway. There are other treatment options too, like oral appliances, which sort of push your jaw forward, create more space at the back of the throat. Surgeries, there are all kinds of surgeries which can be done. And newer devices are something called as hypoglossal nerve stimulator, which is sort of a pacemaker, stimulates your tongue, prevents it from falling backwards. And then there's some other things that are underway in terms of research for treating sleep apnea.
Yeah, no, and I've obviously noticed that the most common is the BiPAP or the CPAP machine, whether it be facial or nasal, and that is the most common. But I've read about surgeries that people do, and even implantable devices. So, is there a best practice, or depending on the age or the medical condition of the patient, how do you decide?
Yes.
When you get to those devices or surgeries, how does a patient decide whether, or a doctor decide whether it's just going to be a BiPAP or CPAP mask, or it's going to be some surgery?
It also comes down to how bad the sleep apnea is. If it is going to be moderate or severe sleep apnea, we're going to push for treatment. It comes down to patient preference. It comes down to the comorbid conditions. Generally speaking, CPAP still remains the treatment of choice. But if somebody is not able to tolerate it for whatever reason or does not want to try CPAP, then we resort to other options like oral appliances, which is generally reserved for people who are relatively not overweight, and then surgical options. But one has to try for the implantable device, one has to try and attempt CPAP
Okay.
first.
And I think that's an important point you just brought up is that I have known patients who are not overweight, thin, appropriate weight, and have sleep apnea. So sleep apnea always associated with obesity and being overweight because of just the weight on your neck and on your airway, but that's not the case. There is a good percentage, right?
Yes, there are many other risk factors. So how narrow your anatomy is, how narrow your craniofacial structures are, how collapsible your airway is, hereditary, genetics, being a male is a risk factor. With increasing age, the airway becomes more floppier. So those are all things that come into play for sleep apnea.
And then the other thing is sleep apnea could be dangerous. I mean, the combination of sleep apnea untreated and alcohol intoxication, something like that, or medication, or explain to our audience, how could that be dangerous to somebody if they're over medicated or they're taking a narcotic, a pain medication, and they have untreated sleep apnea?
Yes, some of the medications can suppress your respiratory drive, the time when you're trying to breathe, especially the narcotics, or there's some other sleep aids. Sleep apnea itself could be dangerous because it could lead to excessive daytime sleepiness, not getting restful sleep, and it has been linked with a whole host of consequences ranging from cardiovascular disorder, depressive symptoms, impairment in quality of life, and so forth.
Yeah, so I think the take-home message right off the bat for everybody, because everybody sleeps. If you are snoring and your partner and your bed partner says you snore, you make noise, or it's a locomotive coming through the bedroom, definitely seek care evaluation to make sure you don't have sleep apnea, because there's some serious consequences besides disturbing your bed partner. It could have serious health consequences on
Absolutely.
You. So I think that's a take-home message with that. All right, so let's move on to another sleep topic. We've talked about sleep apnea. How about people that can't sleep? This is something for me is like, I can't understand that, because I sleep incredibly well. I have my claim to fame is I slept through Hurricane Andrew. So Hurricane Andrew, famous hurricane down in South Florida, destroyed South Florida, and I slept right through it. I don't have a problem with sleep apnea, with insomnia, but I hear that is quite common. So let's talk about people that can't sleep.
It's actually very common. I mean, 50% of us have experienced it at some point or not, and 10% of us have sort of chronic insomnia, is what we say. When somebody has either trouble falling asleep, trouble maintaining sleep, or they wake up earlier than the desired time. And this happens despite an adequate opportunity to sleep, but it has to have a consequence. You have to feel tired or sleepy or some sort of a consequence associated with it before we say somebody has insomnia.
But insomnia could be temporal, yes. Right? I mean, you could be going through a stressful time
Absolutely.
And so forth, and you're worried and you stay up at night and so forth. So when do you get the diagnosis of insomnia? Just because I'm up, a few nights and, my kid is sick or my wife is going through chemotherapy or something like that, that doesn't qualify as insomnia. When does somebody get that diagnosis?
So chronic insomnia is when it's typically been 3 months and these symptoms are affecting somebody more than 3 times a week. That's when we label somebody having chronic insomnia. But again, it also comes down to the patient. And if it's not bothering them, then it's not a problem. If it is bothering somebody, then it's a problem.
All right. So, insomnia treatment, is it just, people can't sleep, they just take oral over-the-counter medications, or how do we do? Is there a cause? Do we try to find the cause?
Yeah.
Let's go through that.
So there are many times there are causes associated with insomnia. So like I said, sleep apnea could present as insomnia. People with sleep apnea wake up in the middle of the night and they don't know. Sometimes people have sleep apnea because they have restless leg syndrome, insomnia because they have restless leg syndrome. They may have insomnia due to underlying medical conditions. They have this acid reflux disease, or they can't breathe because of the heart failure and whatnot. And then there's another common type of insomnia, what we call it psychophysiological insomnia, where people tend to think a lot. They sort of ruminate a lot. And then they engage in those habits, trying to fall asleep very hard and spending too much time to fall asleep and taking naps during the day. So that is another very common type of insomnia. And then sometimes there's no reason for insomnia. So how we approach insomnia is having a very good history. What time do they go to bed during the weekdays, during the weekends? How long are they in the bed for? What is their sleep hygiene that looks like? Are they ruminating a lot? Is there anything else coming in the way of sleep? And then we try to find the root cause of the issue and try to treat it. And then in terms of treating insomnia, there are two major approaches. One is no medications, what we call as cognitive behavioral therapy for insomnia, which is actually the mainstay treatment for insomnia.
Wow.
Yeah. And then other approaches, medications.
So talk to us about that cognitive behavioral therapy. What is that? Like you go to a behavioral therapist? You go to a psychologist or something?
Sleep psychologist.
A sleep psychologist. Mm-hmm. What do they teach you? Like the appropriate things to kind of prepare you for sleep and counting sheep and things like that? No?
Way more than that. Yes. So they provide you with good coping skills as to how to sleep well. It's no medications. It's safe. It's effective. It cannot hurt you. And it does have long lasting effect. Medical data backs it up very strongly.
Wow, incredible. I didn't even know that existed.
Yes.
That's great. And then of course, medication. So I guess the message is, if you are not sleeping well a few nights a week, don't just start taking over-the-counter medication, sleeping aids, right? I mean, how is it that we allow sleeping aids to be sold to the public like that without a professional evaluation and knowing whether you can be treated with, psychotherapy or something like that?
Absolutely.
Right.
Yeah.
I think getting a professional evaluation first and then going through non-medical therapy first would be best.
And many of these sleep aids have long-lasting effects. They have long half-life and they stay in the body for a long time and can cause grogginess, drowsiness, and some other side effects that folks may not be aware of.
Wow. Okay. So we've talked about sleep apnea. We've talked about insomnia. Mm-hmm. You mentioned sleep hygiene. I know, dental hygiene, oral hygiene, bodily hygiene, but talk to us about sleep hygiene. What is that?
Well, sleep hygiene is critical. It's essentially how you sleep. So it starts off by maintaining a consistent schedule, and it makes a huge difference. And if somebody has irregular schedule, I would say start off by waking up every day at the same time. During the weekdays, during the weekends, during the days off, during the days that you're working. So maintaining that consistent schedule, ensuring that the sleep environment and bedroom is conducive to sleep, no electronics, half hour, 1 hour before the bedtime, making sure that the bedroom is dark, it has good temperature, avoid caffeine after 12 or 2, avoid naps, especially long naps. If one has to take naps, take it during the earlier part of the day and limit it to only 20 minutes or so. So those are just some of the basic tips that can really go a long way in improving the sleep.
Yeah, and you mentioned electronics, and this is something that I grew up where I had to have the TV on to fall asleep. And my wife couldn't. Mm-hmm. And then she got used to me with the TV on, and now she needs a TV on to go to sleep. So that is, and I've heard that that's not good, right? No.
So the electronics and TV, the whole idea is they emit blue light, which can suppress the melatonin. So we need melatonin, which is a darkness hormone, to help us sleep. So these light emitting structures would suppress that, and thereby it can affect the sleep quality and quantity.
And I bet you, because of what has happened with electronics in regard to, the constant communication, connection, emails, sometimes the first time I look at an email, because I'm in the operating room all day, first time I look at an email is when I finally got home, ate dinner, talk with the family. Now I lay in bed and I go through 200 emails. That's the worst thing to do. Right?
Yes, as long as you limit it like half hour or 1 hour before the bedtime, and have a set time for that.
Set time. So no electronics, dark room, no TV. So we're going to start cutting out that
caffeine,
TV. No caffeine.
Consistent sleep-wake schedule.
Yeah, and what I've noticed, you mentioned the sleep schedule, is that even if it's on a Saturday, I'll get up at the same time. Not that I want to get up at the same time, but my body has this internal clock that just.
But you didn't do that when you were younger.
No, I didn't. Now, no, it's different. No, it's different. All right. So the other topic I wanted to talk about, which you mentioned, is restless leg syndrome. And I've heard that in my medical career, but tell me and tell us, what is that exactly?
Restless leg syndrome is a condition when somebody experiences this creepy, crawly, uncomfortable sensation in the legs, more like an urge to move the legs. It tends to happen more during the evenings and in the nighttime, and it can really affect people in terms of going to sleep and making them, and their quality of life. They just can't feel that restful feeling. But the good news about it is that it could be treated. There is, again, no medication sort of treatment approach, and there's a medication sort of treatment approach, and it can be easily addressed.
So what is it exactly? Is it a psychological issue, or is it really a physical issue in the leg?
It's sort of actually is a neurological issue, and it is truly an issue because it's not psychological, although
Okay.
one could take your mind off of it by doing some mentally alerting activities, but it truly does affect your legs and sometimes even arms, and can prevent people from sleeping.
And then the treatment is what?
So the treatment is, again, hot compresses, warm compresses, stretching, those sort of things. And these movements typically get relieved when somebody is walking or stretching and doing those kinds of things. We check for iron levels. If somebody's iron is low, we tend to replace that. And there are medications. There are medications which are dedicated towards restless legs. Works very well.
Now, the other thing is, you mentioned stretching and physical activity. How important is exercise and its relationship to sleep? I've always thought, if you're busier during the day or you're doing exercise, you may get better sleep because you're, trying to recover.
Mhm.
Is that really
That's
associated?
true. Yes. So that's one of the components of sleep hygiene, I guess. So try to do exercise, and more so towards the earlier part of the day. I mean, there was a notion that don't try to do exercise too close to the bedtime and so forth. And that has been conflicted many times. But exercise overall would promote good sleep.
Okay. So we talked about sleep apnea. We've talked about insomnia, restless leg syndrome. Any other common sleep disorders that maybe our audience is suffering with, or would be educated by?
Yeah, so there are other common sleep disorders like circadian rhythm disorders, where the internal body clock is sort of misaligned with the external body clock. So, for example, there is something called as delayed sleep phase syndrome, or what we call night owls. These are the folks who want to sleep late and wake up late. And it's not conducive with our conventional norms of the society. So that's a night owl syndrome. Then there are morning larks who want to sleep early, wake up early. And then there's shift work disorder,
Yeah.
right? Which is very common in healthcare industry
Yes.
and many other industry. Again, the reason is because your internal clock is out of sync of the external clock.
So what happens? Like, my little sister is a newborn ICU nurse,
Mhm.
and she worked for years, nights and nights and nights. And she loved it. And I told her, Vanessa, you got to get off of those nights. Does that create a sleep disorder, or does the body adjust? How does that work?
For some people, it adjusts, but for some folks, it causes issues, in terms of trouble falling asleep during the time that they want to fall asleep. And they often feel tired and sleepy also when they're doing their work. And also shift work has been associated with other host of medical outcomes as well.
Wow. Okay. And the cardiovascular health. Well, let's talk about a little bit about that.
Yeah.
The importance of cardio, because at the end of the day, you're part of Miami Cardiovascular Institute, which is a group of cardiologists, interventional radiologists, those that deal with the heart and all the vasculature of the heart. So talk to us about sleep and cardiovascular health.
Yeah, that's the reason I'm there, essentially, because of the tight association of sleep and cardiovascular disorders. So like I mentioned, insufficient sleep is itself associated with high blood pressure and heart issues. Sleep apnea, there's tons of data out there how sleep apnea is linked with hypertension, arrhythmias, strokes, heart attacks. And what happens is when you have sleep apnea, your oxygen levels are dropping, your carbon dioxide levels are building up, you're creating that stress in your body, and that makes you more prone to develop cardiovascular disorders.
Okay, so if you have a sleep disorder, you should start by doing what? We're educating the audience. Everybody sleeps. You're saying a good percentage of them will have some type of sleep disorder. Should they all rush and make an appointment to see you? Should they start with their primary doctor? What are the common initial steps?
So, if somebody's sleep disorder is affecting them in whatever way, it's either causing them having disruption in their sleep or causing them to have excessive daytime sleepiness or impaired concentration, affecting their quality of life, that's the time to really seek attention. Could start off with primary care physician, could start off with sleep medicine specialist, or whosoever you think would be convenient. But I would like to emphasize that sleep health is critical for the overall health.
All right. And then when somebody comes and sees you as a sleep medicine specialist, they're obviously going to get an evaluation. They're going to go through a questionnaire and everything else. But what type of testing will be done on that individual?
So it depends on what they're coming up with. So we do a very comprehensive history relating to the sleep and other medical disorders. And depending on what they're coming up with, we could either order a sleep study, either a lab-based study or home study, and that is primarily to check for things such as sleep apnea. If they're coming with insomnia, we may ask them to keep a sleep diary, to keep a track of what time they're going to bed, what time they're sleeping, napping, and those sort of things. And if somebody is coming who we think is really has something like narcolepsy, that also entails doing an overnight study and maybe sometimes a day study where we're asking them to take some naps and we see how quickly they're able to fall asleep in those naps.
You know, you mentioned diary, and I remember, and I think it still exists, Apple Watch or one of the other watches will tell you how you're sleeping or and your movements and so forth. Are those valid? Are those accurate?
So there are lots of devices out there that are measuring your sleep and sort of providing you some information, how you did on your sleep and so forth, which is good, in a way, because the things that you track, you're more likely going to follow up on those things. So if we are keeping a food diary, we're not likely going to eat ice cream and those kinds of things. So it's good in a way. But in terms of validity, I think there is still room there.
Okay.
Not all the devices are valid, and sometimes people get too focused on those sort of devices. So that's one thing. We don't want to cause insomnia because of the device.
No, of course.
Yeah.
No, but I didn't know whether if they have that device and they sleep with it, would that information be helpful for you as the professional evaluating that patient? Say, hey, look at this. I'm looking at this data on this device that you wear at night, and look at all the times that you move, that you do this, and so forth. I didn't know if it would be helpful or it's just information that.
Yes, to a degree. Yes,
it is helpful somewhat.
To a degree.
Okay.
Yes.
All right. Well, obviously, we've covered a broad topic. We've covered a topic that affects everybody because sleep is important, whether you sleep at night or whether you sleep during the daytime because you work at night and you have an altered work schedule. Everybody has to sleep. And we've learned about some of the key health conditions associated with sleep, of course, sleep apnea and insomnia, restless leg syndrome. So, any take-home messages or any final thoughts that you'd like to tell our audience with regard to sleep, its importance, and of course, its evaluation?
So sleep is critical for the overall health. Sleep is not a luxury, it's a priority. I suggest everyone to obtain 7 to 9 hours of sleep. But if you think you're not sleeping well or you're experiencing any sort of issues because of not sleeping well, do seek medical evaluation.
Yeah, well, great. Another great program, another great show with regard to your health. And this is, of course, an important topic. Sleep is important. We've heard it show after show, how if you don't have enough sleep, you can obviously lead to cardiovascular issues, obesity, and other medical conditions. So get 7 to 9 hours of sleep. Listen to your body, listen to your bed partner. If you have issues sleeping, then seek evaluation. So I want to thank Dr. Walia for being with us here today, talking to us about sleep. And from Miami Community Health, Dr. Anthony Gonzalez signing off.
Thank you.